doing the thing on YouTube, Facebook, and the talk, the tickety talk as we call it, is about to start up. So we've got some Q's and A's. If you do have any burning Q's, send them my way, and I'll do my level best to tackle them, preferably plastic surgery related. I have got some already previously asked, thank God, because if I was waiting for someone to ask one live, might be for some time. So let me, if you don't mind, let me do my first question. And my first question is, do we offer liposuction to the knees? So, I mean, you can do liposuction to any part of the body. So, and we do liposuction. So on that, on those grounds, then you could say, yes, we do liposuction to the knees because it is a part of the body. But it's not common, and it is, so I think if someone specifically wants, the ankles is the other one. I'm going to throw in ankles as well, knees and ankles. We do get people asking for it, and personally I usually don't do it because I find it difficult. It's quite subtle, the to reshape the knee and the ankle. I find it quite hard to do, and unless there's some significant deposition of fat in the area, then I am concerned about. Problem with liposuction is the risks are over or under correction. You do too much or you do too little, and so there's not a huge amount of fat around the knee, and if you do have a significant amount of fat around the knee, you're probably overweight. And I don't, it's not good to do liposuction on people who are overweight because you should lose weight first. Liposuction is really for people who've lost weight, who've got resistant areas. And it's unusual to see a significant deposition of fat around the knee, certainly to the extent that I would consider doing liposuction. So I guess the sort of reflex answer with that would be no. If someone sort of reflexly says, do you do liposuction to the knees? I'll kind of say no. However, if you could always send us a photo and we could have have a look at it. But it's not certainly a thing that I would commonly do a liposuction to the knees. And again, if there is a significant deposition of fat around the knee, it might be that there's extra skin as well. So you've got to think about, do you do an excisional procedure rather than a liposuction? Because liposuction doesn't remove any skin, and so there's a risk that there can be hanging skin. So it's not a common one. So never say never, but I never do it. No, I rarely do it. So it's and it's like any of these things, send us a photo and we'll have a look, but don't hold your breath. I think some people do. I think maybe it's probably more suited to people who do the assisted forms of liposuction, your vasers and your things like that, because I think they do report to give some skin retraction and stuff, so they might be more amenable to it. I think some people do a lot more, some people do a kind of a lot of liposuction. I know there's some doctors who that's all they do. I can't imagine how you could build a practice on liposuction. I mainly do it in conjunction with tummy tucks. That's my main use of liposuction personally. So, to the hips, the flanks, the sides, also gynecoplasty, male breast tissue. So, do we do liposuction to these? Not very often. So, no, not really. What about this one? When I can return to the gym after having a lipoma removed from my back? Is this from the patient today? I just did a lipoma from my back today. Wasn't dressed like this. Changed my shirt because I just got some oil on my shirt. Oh, yeah, I know. I googled it and said put some kitchen paper on it and then put some washing up liquid on it. So I've done that. So fingers crossed. It was a good shirt as well. Well, anyway, what can you do? Anyway, so just so if it was you, then we spoke about this, I think. But anyway, let's do it on the Q&A because let's be honest, we haven't got much else to do. So So lipoma from the back. I mean, the good thing about lipomas is they're subcutaneous. They're underneath the skin, so you don't remove any significant parts of skin when you do a lipoma. You just kind of make an incision in the skin, so the skin isn't closed under any significant tension. So that's good. It's not like you have a big, like a skin lesion, a mole, or something on your back where you're having actually cutting out skin and stitching it up. So it might be a bit tight. So you've got to take it a bit easier in those circumstances. So that's the good thing about lipoma. The skin's often not closed under tension. Usually put a dissolvable sutures and a waterproof dressing on there, so the dressing stays on for a week. So I normally say to people not to be too physical in terms of activities for that first week, because whilst the dressing is waterproof, it doesn't let water in, it also doesn't let water out, and so it can be a bit like a greenhouse. If you get into the gym and get all hot and sweaty, it doesn't really breathe, the dressing. So I would advise you not to get too hot and sweaty for that first week. After the first week, the dressing comes off, and usually it's pretty well healed. We'll keep in touch with you to see how well it's healed. So it sort of, depends on how well it's healed, but usually it's pretty well healed at a week. So you can start getting into stuff at a week. But gently listen to your body. It might be sore. The patient saw today was doing the thing with the barbell on the back, and it went on where the lipoma was. So you've got to be a bit careful if you're actually sort of putting direct pressure on it, or putting like pressure on your back and things like that. But your body will tell you a lot of this. Your body will tell you. So the first week, take it easy, and then see how you go. And if it feels tight, if it feels like it's pulling, then just back off and take it a bit easier. But if it kind of feels okay, then you can do a bit more. So I would say a week to not be doing any sort of strenuous exercise. Obviously walking and stuff is good, but in terms of going back to the gym, after a week you can start going back to the gym, but take it easy, see how you go, and build up would be my regime for the back lipoma kind of thing. But obviously there's lipomas and lipomas. There's some small ones, there's some big ones. So a small one obviously you probably be able to get back a bit sooner, than a big one might knock you back a bit longer. So yeah, that's lipoma back stuff. Can we remove an abscess from above the coccyx bone? So the coccyx is the tail bone, the sort of bottom of your spine, at the top of your natal cleft on your bottom. And so this sounds like a pilonidal abscess, which is a common problem in that area, just above your coccyx bone. And they're extremely difficult to fix. So pilonidal abscess, pilonidal sinus, they're very difficult to treat, and they're usually they're often caused by like hairs on the back which can fall into the natal cleft, and if you get it's a sort of hot and sweaty area, so it the hair kind of grows in and it forms an abscess, and they're very difficult to treat, and we don't tend to treat them. So no, it's usually general surgeons who would do that. You usually have to kind of lay it open. In fact, to be honest with you, abscesses in general, actually we can widen this one out. Actually, we can widen this question out to abscesses. Do we treat abscesses? So we don't treat abscesses. That would be more of a general surgeon or sort of A&E type thing that would treat an abscess. So if you've got a cyst or something like that, we sometimes get calls from people who've got cysts that are infected, they're red, they're angry, and we don't really treat them when they're like that. We would say, look, you might need some antibiotics, you might even need some draining, lancing, let the evil humours out, stuff like that. But we don't get involved with that sort of acute management of it. So we don't get involved with abscess, management of abscess. Abscesses, sometimes it needs drainage, often it needs antibiotics. Once it's all calmed down, then we often do get involved. But specifically for this coccyx bone situation, if there was a pilonidal abscess, sort of the coccyx on the sort of top of your buttocks, we would not do that. That would be a general surgeon, because usually the treatment of the abscess, laying it open, you need to pack it, and you often need daily dressings, and it's quite labour intensive with nursing and often district nurse, stuff like that. So it's a kind of different sort of infrastructure than what we're set up for. We're set up for clean surgery. We don't tend to do infected cases. So as I say, if you've got an infection, we would say to you, look, you need to get the infection sorted, and then we would deal with it once the infection's sorted, if there is a cyst, an underlying cyst or what have you. But these abscesses around the coccyx often need prolonged dressings, and they're kind of healing from the inside out. And then once they're completely healed, then that's kind of the treatment for it. They don't need any more treatment after that. But but it's not really our area of expertise. So yeah, pilonidal sinus, pilonidal abscess would be more of a general surgeon. What is the recovery time following areola reduction? So areola reduction, the areola is the pigmented area around the nipple. So sometimes that's too big. So reducing the areola, it involves, it's a local anesthetic. It involves dissolvable sutures. Personally, I put a permanent suture deep, but you can't see it, so it doesn't require any sutures to be removed. So the skin sutures are dissolvable, and so you have a plaster basically on there, and that plaster's on for a week. You take the plaster off for a week. To be honest, it's a common theme. Plaster for a week is kind of like pretty much everything, whether it be a breast implant, a tummy tuck, a mole removal, an areola reduction, plaster on for a week. So yeah, plaster on for a week. Again, waterproof one in this situation, so you can shower and what have you, but you've got to take it easy. So probably this is actually going to probably sound similar to the lipoma removal one. Yeah, so take it easy. You can get it wet in the shower, but you don't want to get too strenuous with your exercises and stuff. You don't want to put too much tension on your chest, because obviously an areola reduction is closed under tension, because you cut out the excess areola, you cut a donut of areola out, and then you cinch in the outer circumference into the inner circumference, so it is closed under tension. So you don't want to put too much tension on the wounds in terms of doing physical activities for your upper body. Lower body's fine, walking, like the stepper, stuff like that. Is it called a cross trainer? But not with the arms. The foot thing. Anyway, there's actually a step. There is a step. Is the step of the step? There's actually steps, isn't there, in the gym? They got steps which should continuously go. Is that called a stepper? I was more thinking of the thing. Anyway, steps, stairs. You could do stairs, and so lower body stuff. And then after the week, the dressing comes off, and there is often little bits that haven't healed. It's not uncommon to get little bits that haven't healed, because it's kind of whooshed up the scarring. So maybe a couple of weeks, I would say, before you want to start getting into things, because your dressing comes off after a week, but that second week there might be little bits and bobs which are not completely healed. So I'd say 2 weeks before you can start. Well, as I say, lower body things straight off the bat, but 2 weeks before you do too much upper body things. If you're sort of working and desk job and things like that, you can get back to work probably next day, really. You don't really have to have a huge amount of time off work, but you might feel a bit bruised, a bit uncomfortable, might feel a bit tight for a good week. And as I say, you don't want to be putting any tension on the wounds for 2 weeks, and then you can start doing stuff with your upper body in terms of the gym and activities like that. I hope that's what you mean by recovery. Obviously, it depends on what you're doing, if it's talking about return to work, but that's kind of giving you a flavour, if you like, of the areola reduction regime. So what's the question now? Abdominoplasty versus laparoscopic surgery, drain or drainless? Yeah, to the point. That's what we like. Abdominoplasty versus laparoscopic surgery. Yeah, I don't really understand that. So laparoscopic surgery. Laparoscopic is keyhole surgery, where they put little tubes in and they look through a telescope and they do stuff inside. So they take your gallbladder out. You can do hysterectomies, you can do appendicectomies, you can take bits out of body cavities using minimal incisions. That's the good thing about laparoscopic surgery. It doesn't really apply to a abdominoplasty. You can't do a laparoscopic abdominoplasty, because the whole thing about abdominoplasty is you're taking a big bit of skin out. You've got too much skin, and so putting a tube in and looking inside the bowel isn't going to help you take a big bit of skin out. So I'm not sure where you're going with this one, abdominoplasty versus laparoscopic surgery. The only thing I can think of, you might be thinking, is the divarification of the recti, the muscles, a laparoscopic muscle repair. Maybe that's what you're thinking of, which is a part of an abdominoplasty, bringing the muscles, the six-pack muscles together. Is sort of an integral part of an abdominoplasty, but I would say the main part of an abdominoplasty is taking off the excess skin, the excess skin of the abdomen, and that is something which kind of by definition can't be done laparoscopically, because laparoscopically means with the telescopes. So yeah, that's not a comparison. Abdominoplasty versus laparoscopic surgery they're two different things. Drain or drainless depends on the surgeon. Personally, obviously, presuming you're asking me, I am a drain. I'm a drain kind of guy. I think probably definitely the movement in terms of plastic surgeons is towards fewer drains, just in generally what we're doing. And I'm certainly using a lot less drains than I used to. I don't use any drains for breast surgery pretty much, except for a very big breast reduction and a capsulectomy. But a lot of surgery I'm not using drains anymore. But tummy tuck is one of the ones I still use drains. I do quilting stitches, which kind of closes down the space. The reason there's a question about drains or drainless is because when you do a tummy tuck, there's a space there, and the space can fill up with fluid, and so the drains will drain that fluid and suck it down. And but people don't like drains. They're uncomfortable. They keep people in hospital. Because personally, I don't like sending people home with drains, so it keeps you in hospital overnight. A lot of people are doing tummy tuck stay cases now. So they're using, the quilting stitches, glue, things like that. So I do use quilting stitches, and it might be that I would be able to not use a drain, but I haven't taken the plunge yet, and I still use drains. And it is, people who use drainless techniques say they've got a low risk of seromas, but it's extremely low in my practice. And so, even though, I don't know, 8% or something, sort of whatever the quoted seroma rate is, I've had one that I can remember. I must have had more than one, but I've had maybe another guy with a bit of sweat. But, it's pretty low. Anyway, less than 1%. Yeah, that's why I still use drains. So I just use them overnight. So they come out the next day. And I do use drains simply because I want the drains are under negative pressure and they suck the skin flaps together, so make it that there's not a space there for a seroma to collect. I understand that it can be done drainless, and I know that a lot of very good surgeons do it very safely drainless, but I just worry about my seroma. Seroma is just a nuisance. It's not a disastrous seroma, to be honest. It's a bit of fluid collecting in the tummy, and you can come into clinic and drain it off, so it's not actually a disaster if you do get a seroma, but it's just that it's not a problem. Seroma is not a problem at all. I don't see it at all. And so I don't really want to change my practice because it's just going to be a nuisance if we start getting seroma, especially if people live a bit far away and have to come in. And sometimes seromas, you have to keep coming back, the drainage, and it can be a bit of a nuisance, to be honest with you. So that's why personally I still use drains, but I do understand that a lot of surgeons are using drainless techniques these days. The other thing is I think a lot of people kind of don't want to go home same day. So that benefit of the drainless, the fact they can go home same day, isn't kind of great, because I find a lot of patients would rather stay overnight because the tummy tuck's quite a big op. So that's kind of takes away from the benefit of drainless, really. So I'm not really pushing the drainless because, yes, it's not very nice having drains in, but if it's not very nice having seromas. So that's where I am. And we're all different, and that's what makes the world such a rich and colourful place. So I have nose piercing marks. The hole is closed, but the marks are present. How can I remove the marks? You can't. I mean, basically what you're saying is you want to remove the scar. And this is the problem when people say, I want a scar revision, because it's like, well, what's the problem? Because, they often say, plastic surgeons, they'll like remove the scar. Well, we can't remove a scar. If we do stuff, we just create scars. And we can sometimes create a better scar if there's a specific problem with the scar, if it's stretched, if it's dented, if it's lumpy, if it's in a funny line, a funny shape. We can change those things by giving you a better scar, but we're still giving you a scar. So if you've got a piercing, which is just a tiny little scar, and you're saying, how can I get rid of it? There are things you can do if it's early, if it's like less than a year, massage, moisturize, bit of pressure can help. But if it's just like the red, and the red mark will often fade, and the color might get to skin color, it might be a bit less dented in. But if you don't like the fact that there is a kind of mark there, which is which is where you've had that piercing, I have got nothing to remove that. And I do worry about people who say they want to get the hole removed. So, because we will cut out the hole and still give you a mark, because as you say, there's still something there, a kind of memory of what was there before. So it's a tricky one. My cousin's daughter actually had asked, said, could I fix it? And that I'm like, I can't. I mean, she had the hole and she wanted me to cut. I'm like, I could cut it out, but I'm just going to give you a scar and you feel bad, but it's like I think people think plastic surgeons are kind of really good, but we're only human, at least I am. The others probably are, maybe the others have got something, but I am IMHO. There's nothing I can do for that. That's a scar and time, as I say. But if it's over a year old, unless there's a specific problem, unless it's particularly dented in or if it's lumpy or something, but it's probably just like a red mark. Sorry about that. Anyway, I know there's probably lots of questions out there, but I've got to get the potatoes out of the oven, so I probably burnt them, to be honest with you, already. So if you can just hold the questions for now, for the normally queue, and if you can post them in the comments, and I'll do them next week, because I know there's once I open the floodgates, it just goes bonkers. So please do message me or call me or I guess those are the two main ones, really. Or email, I suppose. Message or call or email me if you've got any questions, and I will do my level best to address them in a timely fashion. 7 o'clock next week, I'm going to be here, not there, I'll be here, and expect you to do likewise. So I will stop the chat and go and save the potatoes. Save the potatoes.